Your omega-3 status can actually reduce your risk of depression. Hello, I'm Dr. Michael Gaeta. Welcome. I'm just going to share with you some new research that was just published, very significant, on how to reduce the risk of major depression. And this is an offering of the Gaeta Institute for Holistic Health Education, where our motto is nature first and drugs last. And we provide practitioner education, public education, and clinical practice, clinical consultation for patients. So let's jump right in. And this study is very significant. This just came out in the Journal of Affective Disorders. It's available online. We're going to give you the link to this study so you can read the whole thing yourself. Just going to give you some highlights, and then you can dive in and get the details as you like. But I'll give you the important stuff and how to apply this information. And this will be published in the Journal of Affective Disorders in October, so 3 months from now, but it is available now online. So this is a study out of Switzerland, and it's called Associations of Omega-3 Fatty Acid Status and with Pediatric Major Depressive Disorders in Swiss Adolescents, a case control study. So this was looking at the omega-3 status of these kids to see if based on their omega-3 status, which kids did better, which kids had less depression, and which kids had more, was sort of the intent of this study. Very significant. So let's take a look. Let's look at the highlights of this study. And it's pretty amazing. And I think this has great relevance to everybody, not just Swiss adolescents, but everybody. So let's just take a look at what this study found. I'm just going to blow it up for you a little bit. And they found a higher omega-3 index was associated with lower odds for pediatric, so childhood, major depressive disorders. Now, why is that important? Well, it's important that we take care of our kids, right? Protect and care for our kids well. And there are many risk factors and contributors to pediatric depression. This particular study kind of caught my eye and my heart also in wanting to share it with you because, this is my own personal history. The age group of kids they looked at in this particular study were kids who were age 13 to 18, I believe. And during that time period in my own life, many years ago, I suffered from major or pretty significant. I wasn't psychiatrically diagnosed, but for me, it was pretty significant depression with suicidal ideation. So I really, strongly considered ending my own life at certain parts of my life in that age area. That time of my life was pretty dark. And so when I read this study, like, wow, if this is one thing among many factors that can really help kids avoid what I went through, boy, oh boy, that would be great. So that's another reason why I wanted to share the study. It's very interesting, but it also has kind of personal relevance to me, given that it's my own, personal health history, mental health history in particular. So let's see what this study said and how we can apply this in helping kids, because it's really pretty amazing. So let's get into the specifics here. Also, they found that higher red blood cell omega-6 to omega-3 ratio, very important, was associated with higher odds of pediatric major depressive disorder, PMDD. Now, omega-3 and omega-6, these are unsaturated fatty acids. And they have, they're pretty long as fatty acids go. And the omega-3 means there's a double bond 3 away from the omega end. And omega-6 means there's a double bond 6 away from the right side, the omega end. And that's basically what it means. And so the ratio of omega-6 to omega-3 is really important.
And so we have the omega-3 index, and let's define what that means. So we have two things we're looking at here. Omega-3 index, omega-6 to omega-3 ratio. Those are the two big things we're looking at. And just to finish this kind of summary, the intake did not matter as much as the index and the ratio. So that's pretty important, that how much the kids ate in their diet was less important than how much actually was in their system. And I'm going to explain what that means. So first thing to look at is what's an omega-3 index? Well, in your red blood cells, and mine and everybody else's, we have about 64 fatty acids that make up our red blood cell membrane. Red blood cells are pretty small. They're a biconcave disc, so they kind of look like that. And their diameter is just 5 to 7 microns, which is really small. So that membrane of those red blood cells, the health of that membrane is very important because those red blood cells keep us alive. They deliver oxygen to our cells. Hemoglobin carries that oxygen. Each molecule of hemoglobin can carry 4 oxygen molecules, and that hemoglobin is inside the red blood cell. Red blood cell delivers oxygen through that hemoglobin. So it's really important that the membrane, the cell membrane, the shell, so to speak, of our red blood cells is very happy so that oxygen can be delivered efficiently to our cells and keep us going, and also help us just to be energetic and have a good immune system, and have good oxygen and athletic performance, and like everything depends on oxygen. So, if you've held your breath for any period of time, you'll understand that. And so that cell membrane is really important. Now, of those 64 fatty acids that make up that red blood cell membrane, 2 of them are omega-3, are EPA and DHA. And they have long names, but we can abbreviate them EPA and DHA. 2 of the most important omega-3 fatty acids. Certainly the 2 that there's been the most research on, for sure, over the last 40 years or so. And this red blood cell fatty acid content, EPA, DHA content, should be at least 8%. What does that mean? This is what we call the omega-3 index. That means that at least 8% of all that fatty acid, all those fats in your red blood cells need to be EPA and DHA. So your omega-3 index is very, very important because it tells us how much of your red blood cell fatty acids are made up of EPA and DHA. There's a million benefits to getting this to that very clinically research validated at minimum of 8%. A lot of things go well when it's at least 8%, and a lot of things go wrong when it's below 8%. Chronic inflammation, all-cause mortality, a lot of things go south when you've got a low omega-3 index. Tragically, the United States, with its high sugar, low healthy fat diet, does not. We have a atrocious national omega-3 index average of 4%, which is no bueno, to say the least. So this is a big problem. So one of the best things you can do, simplest things you can do, cheapest things you can do to improve your overall health in a lot of different ways, which we're not going to get into every single way, but just in a lot of ways: immune, cardiovascular, cognitive, athletic performance. A lot of things get better when you get that, when you test it, first of all, and get that omega-3 index at least 8%, meaning, again, to review, at least 8% of your red blood cell fatty acids are made up of EPA and DHA. All right, so that's what they looked at in this study, was the omega-3 index, a very, very important number for everybody to know, because it's a simple, easy, cheap way to improve your health and prevent chronic disease and just live better. If it's low, correcting that is a big deal. So that's the first thing. The second thing they looked at was the omega-6 to omega-3 ratio. Now, this is a big subject. Just going to pull out a little bit of it. Omega-6 fats are found in a variety of foods. And what's important is how much omega-6 compared to omega-3 is in our diet. Now, there's a lot of mythology and just completely wrong information about, the evils of omega-6 and arachidonic acid and meat causes inflammation and will kill you and your head will explode. You'll burst into flame because of arachidonic acid, which is an omega-6, one of many. And this is just false. The problem is not the presence of omega-6, but the ratio of omega-6 to omega-3, which means that the problem isn't as much. It's a factor, but the big deal is not the presence of omega-6, but a deficiency of omega-3. So thankfully, we can use the same test actually to compare how much omega-6 do you have compared to how much omega-3 do you have. And that ratio is really important. Ideally, that number is 4-to-1 or less. And 5-to-1 is sort of borderline okay. So let's just call it 5-to-1 is the absolute upper limit for sure, big time, of how much omega-6 to omega-3 you have. And you can best check this or easily check this looking at a finger prick blood spot that you send to the lab, and you'll get your omega-3 index, really important, and your 6-to-3 ratio, also really important. And those are the two data points, the main data points they looked at in this Swiss kid study. They also looked at how much alpha-linolenic acid, omega-6, and EPA and DHA intake there was, and that wasn't as important as what actually showed up in the blood. In the red blood cells. So it really highlights the importance of looking at your omega-3 index, looking at your 6-to-3 ratio. Make sure your 6-to-3 ratio is 5-to-1, meaning 5 omega-6 to 1 omega-3 or less. If it's 4-to-1, 3-to-1, 2-to-1, 1-to-1, that's even better. So you have loads of omega-3. So this whole meat causes inflammation is nonsense. The problem is a deficiency of omega-3. And by the way, the quality of meat you eat is important. Big difference between the omega. This is just a little tangent, little bonus tangent on terms of your diet. There is a big difference between factory farmed, feedlot, grain-fed beef, which has very little omega-3, and grass-fed beef, which has loads of omega-3, tons, just ample omega-3 in that meat. So it's really a quality issue when it comes to the meat and dairy that we eat, if that's part of our diet, and really kind of important to have in a human diet, an omnivore diet, where we eat a range of animal and vegetable foods, that we have quality foods. And so that means, grass-fed beef, good, grain-fed, factory-farmed, feedlot beef, bad. And one of the reasons is, aside from the steroids, hormones, antibiotics, is the omega-3 content of that grass-fed beef, plus it tastes better, is much better. So with that little intro, detail bit, we'll get back into what this study found, which is really astounding. So that's the kind of highlights of the study. They looked at the omega-3 index, which everybody, you, me, everybody needs to really carefully look at, and look at the 6-to-3 ratio in the red blood cell. Really, really important. Everybody needs to check this. And the differences were astounding. So let's do a little deeper dive. We looked at the highlights and what they found. And they in the background of the study, they acknowledge that the published research at least suggests, I think it's a lot stronger than suggests. I've read a lot of this research and it's very strong in aggregate. You put all the research together, it's very strong. A link between omega-3 status and depression in adults. So this is, and we're not going to go through that research, but it's there. You can look it up, go to PubMed or Google Scholar or Science Direct, something like that, to look up the research that's been done on this. So this study was unusual in a good way, in that it was looking at kids. Now, then this study looked to determine associations of omega-3 with major depression in kids. Really important. Now, one of the reasons this is really important is because of the complete catastrophe, the global catastrophe, one of the greatest catastrophes in human history, which were the COVID measures, right? The most devastating thing to humanity was not COVID, but the government response to COVID was far more devastating, including the mental health of kids who stupidly were kept out of school, or wearing these stupid masks and kept away from each other. None of this stuff had a shred of benefit. So this study is another reason I want presenting this study, is because it's post-COVID nonsense, where we seriously injured millions of children and adults with, and not even getting into the catastrophic experimental injections, which have no benefit and lots of harm, but the COVID measures, no benefit, lots of harm. Distancing, masks, closing schools and churches, businesses, none of this helped and did a ton of harm. And one of the biggest problems with that was a spike, I mean, almost a vertical line on a graph, of depression, anxiety, suicide, homicide, violent behavior, alcoholism, addiction. Every psychological metric got massively worse, tragically, catastrophically, massively, incredibly, seriously worse, not because of COVID, but because of the COVID measures, the lockdowns and all that kind of everything entailed with that. So this study and the implications of the study are extra important. So there's a little more context for why I'm kind of sharing this paper with you now. And plus it came out a week ago, right, as of this recording. So it's very new. Today is July 19th, 2023. This study came out 6 days ago online and will be published in a hard copy peer-reviewed medical journal 3 months from now. So thankfully, they didn't wait for the print publication to release it online. And that's really, really good. We're going to have a bunch of links for you in the description that you need to click on to read the study, and I'm going to give you specifics on how to apply it. All right, so let's get back into that. So more background. And it's really important, by the way, before we get off the subject, that we never let that happen again. The government health authority measures injured or killed millions of people worldwide. And so we must never let that happen again. This type of stupidity was not based on science, not based on evidence, not based on anything but fantasy. It was just used as an excuse to institute totalitarian control of the population, which they did not want to let go of once they had it. It's very bad. So, word to the wise, never let the government do that again. To you, your family, your community, you must definitely disobey any of that sort of nonsense if anything like that happens in the future. Hopefully it won't. All right, back to the study. So what did they do? They looked at 100 kids who were diagnosed with major depressive disorder, okay? And they looked at another 100 kids, roughly, who didn't. And they were 13 to 18 years or 17 years. So they have almost 200 kids in this study. Some had depression, some did not. Then they drew blood. It's just a finger prick, a little blood spot, we call it. And they looked at their red cell fatty acid composition. That's called the omega-3 index. And then they also looked at the 6:3 ratio, the two important data points. And then they looked at, well, how much omega-3 are all these kids eating? Looking at a diet questionnaire. And they used a very typical in psychiatric, in adolescent psychiatry, this CDSR is regularly used, this Children's Depression Rating Scale. So they looked at intake, they looked at omega-3 index, they looked at 6:3 ratio. What did they find? What were the results? The average EPA and DHA were lower in the kids with depression than the kids who weren't depressed. And check this out. This is pretty remarkable. These results were astounding. I was really kind of blown away. So it was a significant difference. Actually, this particular part of it wasn't massively different, but the kids who were depressed had a 0.41, and the healthy kids is 0.46. So it's 0.05 difference, very, very validated with a very low P number. And that was for EPA. DHA, there was a bigger difference. And that's interesting because DHA, we think of more as the neurological, cognitive, brain-related omega-3 is the DHA. And this was a much bigger difference. It was 4.07 in the kids with depression, and about 0.7 difference, not 0.05, but a 0.7 difference. So 4.73, much, much higher in the kids who without depression. And then, so that's a huge deal. The DHA status was hugely different in the depressed to the healthy kids. Then, so that's that. Then they looked at the omega-3 index. So what was the total percentage of the EPA and DHA in these kids' red blood cells? And, in both cases, it was kind of low. We're aiming for 8, but look at the difference, 4.5, which is really low. That's almost American bad. And this is Switzerland. So this is almost American bad, 4.5 in the depressed kids. Now think about that. It's worse in the average American than in these depressed kids, like majorly depressed kids. So we're seeing from this data that a lot of folks who suffer from depression, not all, not one thing does everything, but folks who have depression, and everybody else, by the way, this needs to be evaluated carefully. Because look at the difference, 4.5 in the depressed kids, 5.2 in the healthy kids. So that's, again, about a 0.7 difference, similar to the DHA difference, about 0.7 difference in the DHA, 0.7 difference roughly in the omega-3 index. Now imagine if they got these kids up to 8, which is the validated number target to go for everybody. So I've been practicing Chinese and functional medicine for 33 years and having treated thousands and thousands of patients, including hundreds with what we might call psychiatric or psychological, difficulties. It can be very serious. And it was certainly my own experience, very serious. So here's a thing that we can correct. It's easily fixed with no drugs. Kind of fits into our model here of nature first, drugs last, that you don't need drugs for this, right? At least some people with depression, adults and children, at least part of the cause, we want to get to the root cause. That's one of the pillars of holistic healthcare is root cause resolution, not just managing symptoms with drugs. If we can address the root cause, at least part of it, in at least some people, adults and children with depression, wow, that's amazing. Look what we can do to improve people's lives and maybe avoid these very, very dangerous psychiatric drugs, right? Which, the evidence, it's nobody's opinion, but people who take psychiatric drugs, including antidepressants, especially SSRIs, but others as well, they are way more likely to hurt themselves or other people. So, and that's just managing symptoms, maybe. So here's a simple, cheap, effective, non-drug thing that may help. I'm not guaranteeing an outcome, not promising an outcome, not saying this is everybody who's depressed. I'm saying some people who have depression, and there's a lot of undiagnosed depression, by the way, or just people who don't feel good, right? You don't need a name. You don't need a diagnosis. You don't need a term. You're just feeling low most of the time. And I really, really, really know what that feels like personally. And thankfully, have helped hundreds of patients over more than 3 decades working with this stuff. There's that thing, you kind of attract those you can help, right? And that was me, so I just happened to have attracted over the years of practice a lot of people with depression. And thankfully, I've been able to help just about all of them. And one of the things I do, not the only thing, we also do, nutritional and herbal and acupuncture and lifestyle, diet, mind, body, recommend, counseling and such as needed, groups, social support. It's a broad approach, but this is one important piece that's easy to assess and fix. So what a big difference. That's like a pretty big deal. So if we can assess and correct this omega-3 ratio, omega-3 index in children and adults, they'll feel better. And even folks who don't have depression, maybe you just want to feel happier, right? Who doesn't want that? So even if you don't have depression, here's something that can help your mental, psychological, cognitive, emotional well-being, right? We don't just have to look at disease. How can we treat disease? Well, how can we feel better? How can we optimize our lives? How can we have a better quality of life? Here's a simple way that might help. Certainly what I've seen clinically, big time. Moving on. And then they looked at the omega-6 to omega-3 ratio, 6:3. And wouldn't you know it, it was higher. It kind of went above that messed up threshold of 5 in these depressed kids. They were 5.5. Now, it gets a lot worse than that. The average ratio in the United States, tragically, is close to 20. So these Swiss kids weren't as bad as the average American by far. So they were 5.5, which isn't terrible, but it's high because it's above 5. And wouldn't you know it, bada bing, as we New York Italians say sometimes, the healthy kids, it was below 5. Just like I said, that's the upper limit. And these kids were below the upper limit. So that's a good thing. And think about it, some populations in the United States, subgroups, areas of the country, the omega-3 to 6:3 ratio is 50, which is insane. So, the likelihood that this is a factor in mental health is huge. Again, is this the only thing we look at? No. Is this the only intervention? No. Do these people need other help who were working with this stuff? Yes. I had a guidance counselor who helped me a lot in high school. And before I got to high school, a book fell off the bookshelf onto my head, Wayne Dyer's Your Erroneous Zones. That helped me out a lot too. So it's not the only thing, but this is one useful piece that's clinically, scientifically, evidence-based, validated, and certainly clinical experience of practitioners like myself. And I have a family practice, so working with a lot of people with a lot of different things can really help. So then check this out. Continues. Adolescents with a higher omega-3 index, again, higher is better, had lower odds for depression. Now, this is amazing. They reduce their risk of depression. This is OR, means odds ratio. Like, what's the chance this is going to happen? They reduce their risk of depression by 51%. One more time. Adolescents with a higher omega-3 index had 51% lower odds risk for being depressed. I mean, wow. 51% reduction in depression risk with a higher omega-3 index. Imagine If we got all these kids, and don't forget the adults, it's the same, up to 8%. Man, we have a massive, massive improvement in just quality of life, mental health, and avoiding depression, which depression sucks when it's, it can get really bad. And I'm not talking like I'm having a bad day. This is like persistent feelings of worthlessness, lack of motivation, ambition, withdrawal, loss of interest in life. Is a whole range of factors, whole range of symptoms. I'm not going to get into all that, but this is amazing. In contrast, the omega-6-3 ratio was associated with higher odds for depression. In other words, if your ratio was above 5, which is the upper limit, which is very validated, your risk of depression with a higher 6-to-3 ratio, again, we're aiming for 5-to-1 or less. That's what it should be. But if it's higher, your risk of depression goes up 58%. Odds ratio 1.58 means risk increases 58%. Yikes. So that's astounding. Absolutely incredible. Intake of an omega-6 called alpha linoleic acid. Would have been nice if they looked at other fats, but that's okay. The intake did not differ between the depressed kids and the healthy kids. So it wasn't about intake. It was about what's in the blood. And that's why we need to check, right? Now, I do recommend to all my patients that they eat wild fish 3 times a week, at least. It's a good thing. But we've got to quantify this. This study is astounding with these roughly 200 kids in Switzerland. So conclusion, our results suggest that a higher red blood cell omega-3 polyunsaturated fatty acid status, PUFA, during adolescence. How's your PUFA? Is what we're finding out here. Is associated with a lower risk of pediatric major depressive disorder, whereas a higher 6-to-3 ratio is associated with a higher risk, like a lot higher risk, for major depression. That's massive. That is absolutely massive. So what do you do about that? And we've got very specific links. Please share this video because this can help kids and it can help adults too. They didn't look at that in this study, but there's a lot of other studies saying the basic same thing, that omega-3 matters and omega-3-to-6 ratio matters. Omega-3 index and 3-to-6 ratio matters in adults. I love this study because they're looking after the kids. This helps. Is like, let's quantify, let's get the data, let's get it right, and look at what's going on with the kids, because adults need to help the kids, protect the kids, raise the kids, and not the government, but the parents, not the teachers, but the parents. We've got to look after our kids. And if you're a practitioner, oh boy, look at all the good you can do for your patients. It's kind of a big deal. So what do we do about this? Now we're going to get into some practical application. It's very important. So you're going to get a link in the description for this video. Please share this. This is potentially life-changing information. And, from my own personal experience with multiple episodes of suicidal depression, suicidal ideations, many years ago, and I'm not resentful of that time. It sucked, but it helped me grow. I got through it. Life had, each of us has a great purpose for our life. And I think it was that feeling, something, I think it was divine intervention, something prevented me from killing myself. But I have a real soft spot, for children and their mental health, because it's important. And it's also they're the future, right? They're the future. So there's many other factors that affect kids' mental health, right? Do they have, a mother and father, or at least figure in their life? You need both. Nutrition, exercise, sunlight, getting outside, staying away from screens, minimizing that. There's a lot of other factors. Maybe that'll be another video. But this is one thing we can really do that is absolutely effective. Absolutely. Now, nothing works 100% of the time, but this is like pretty astounding research that we need to know about. So please share this with everybody you've ever met so that we can help the kids. And by the way, the adults. It's not just the kids. So here's what you do. Let's just do what they did in this study. Do what they did. Do what the researchers did with these 200 kids. So here's the first step. You're going to see a link to this. It's omegaquant.com/ref/493. That's our link to the Omega Quant website. You'll see this in the link. And this is a referral link. It helps us out a little here at the Gaeta Institute. If you use that link, puts a few shekels in the coffer there for us, so we can keep offering really good content like this for free, to the public and to clinicians. This is very relevant for clinicians as well. And this is the company that offers, not the only one, but certainly the one I use for this test. And you go to Omega-3 Index Plus. That's the one you want. You click on that. And it's just $80. I mean, think of the millions of dollars that we spend collectively managing the symptoms of depression in kids and adults without actually getting to the cause. It's just messing with symptoms at significant risk of harm, right? So let's click on View Sample Report, and you can look at this yourself through this link and click on that, and you'll see what their result looks like, which is kind of a big deal. And you'll see right here, I've done this, I do this with every patient because it's so important. Getting this right is it's not the only thing, but it's a big thing. So look at this. Here's the omega-3 index, and the percentage of red blood cell fatty acids made up of EPA and DHA. And they have here the desirable range. So let's look at this in a little bit of detail. And they have here the desirable range, 8 to 12. This particular patient had a result of 6, which is still better than the healthy kids in the study. And here's the pathetic American average of 4%. And this is what we're aiming for, is 8% or more, right? More is better. They recommend 8 to 12. I mean, there is such a thing as too much. I've never seen anybody with too high. And this patient was down here. So kind of halfway between the pathetic American average, and other countries as well have very low omega-3 index, and the minimum of 8%, which is what you want to go for. So that's the first thing you need to know for you and your family and everybody you ever met. And if you're a clinician like me, you got to know this number for all your patients. It's a big deal. And then we go down a little further to a very important, this is the second thing they looked at in this study. They looked at this other number in the study, which is the 6-to-3 ratio. And here it is, upper limit 5 to 1, right? And this patient was 6.3. No bueno. Worse, actually, than the depressed kids in this study. Not good. So this patient's over here, 6.3. We've got to get this puppy down to, below here. 3 to 1, 5 to 1, even less than 3 to 1 is great. And then this study, but wait, there's more. They also look at the arachidonic acid to EPA ratio, which is very helpful for assessing possible causes of chronic inflammation. And chronic inflammation is the common thread in all chronic disease, cardiovascular, cancer, diabetes, whatever, Alzheimer's. Common thread in all chronic disease, pain, is inflammation. This is one of the causes of inflammation, is when this 6-to-3 ratio is too high, and when the arachidonic acid to EPA ratio is too high. And this really should be a maximum of 11, which is right around here, This patient is 12.2, so a little above that. And honestly, I think it should be lower than that. I think 8-to-1 would be even better. But the lab has a perfectly validated upper limit of 11. That's okay. And arachidonic acid is essential omega-6 fatty acid. And we want to have the comparison of that to EPA, which is one of the omega-3 fats found in fish, to be good. So you got to know this number. This is the other number the lab, this published research looked at was the 6-to-3 ratio. You got to know that number. Really important. And you can think of the AA-EPA ratio as a subset of the 6-to-3 ratio, because the AA is a 6, the EPA is a 3. So this is like a subset of the 3-to-6 ratio. Okay. So you got to know that on everybody. Everybody's got to know these numbers. Everybody. And then they even give you a little more, which is a dietary outcome, a dietary intake measurement, which is interesting, which is your trans fat index. How much trans fat, typically artificially hydrogenated fat, do you eat? And it'll tell you. This number should be, 1% pretty high. Actually, it should be a little lower than that, but 1% is perfectly fine upper limit. This patient's doing good. Their trans fats, partially hydrogenated vegetable oil is the most common source. Bad fats, ultra bad fats. Again, saturated fats, naturally saturated fats are healthy. Artificially saturated fats, hydrogenated fats, are bad. And this tells you how you're doing with how much bad fat, hydrogenated fat, are you eating. And this patient is doing just fine. Have a low intake, 0.36, well below the upper limit of 1%. And that's another, great data point you get from this test. And then they give you, and this is not specific to anybody, this is the same on every report. They give you a list of foods that are, and their omega-3 content, which is great. Highest omega-3 content is in herring, and then also really good wild salmon is great. So wild is always better than farmed. It's good to ask. So between herring and salmon, wild, eating that 3 times a week is a good thing. This is just 3 ounces, not a lot. So eating at least 3 ounces, I think more is better, 3 times a week of wild fish is a good thing. That's the best source of preformed EPA, ready to go EPA and DHA. And then if you've got a deficiency, the diet alone, the research tells us that diet alone is not the best thing. You want to combine the diet with supplementation. So anyway, here's the test that everybody should do. No exception. Now, if I was treating this patient with an omega-3 index of 6.1 and a high 6-to-3 ratio of 6.3, which really should be 5-to-1 or less, I would be recommending that. And I've got many patients where this is their result, and I recommend they eat wild fish 3 or 4 times a week, so every other day, roughly. And in addition to that, take a clean, sustainable fish oil. And you'll see the links to this in your description under this video. This is the basic formula that I take, that I give my kids, and this is the standard process cod liver oil. These are the best supplements in the world. And this is the cod liver oil, small batch Norwegian cod liver oil. Each batch is tested for bad stuff. They don't strip out the vitamin A and add back synthetic vitamin A the way a lot of products do. Just a good, clean, sustainable fish oil from Norway. And it's a great product. I take 3 of these a day. My kids take 3 of these a day. It's just a basic. Everybody should take this. No exceptions. Great product. And then if there's and this will maintain your omega-3 status. If it's good, this will help it stay good with your 3 times a week of wild fish. Now, with this patient, with a low index, high 6 to 3 ratio, I would add to that more of a therapy. And this cod liver oil is like a daily maintenance fish oil. But I would add to this at 3 a day, a therapeutic fish oil, just to get that ratio fixed, to correct that. And this is called Olprima EPA DHA. And this is an anchovy sardine concentrate. It's not a daily maintenance fish oil. It's really a therapeutic, like we have something to fix fish oil. And this is one of those things that might need to be fixed. And this combines EPA and DHA in one, again, clean, sustainably harvested fish oil. Again, it's not as broad spectrum nutritionally as the cod, which, that's why it doesn't replace it. It's an in addition to. But 3 cod, 3 Olprima is what I would recommend to this patient that we just looked at the results for, if that was my patient. And what I do recommend, and this reliably, very reliably, so far 100% success in my own practice, that little combination really does the job. And then since your red blood cells, this is really important, your red blood cells have about a 4-month lifespan. You repeat this test every 4 months. And that's how you know if what you're doing with your diet, and diet is the foundation, supplementation is in addition to that foundational supplementation, you'll know if what you did was enough. Like, am I taking enough omega-3 in my diet and in my supplementation, right? So you'd recheck that omega-3 index every 4 months. Now, if you're working with a practitioner who practices functional medicine, or one of my students, who I've trained over 20,000 of them over the years, over the last 30 years of teaching, they will sort all this out for you. Or if you'd like a consultation with me in my clinic, Gaeta Clinic for Chinese and Functional Medicine, you just go to michaelgaeta.com and go to clinic. So that's what you do: test, diet, supplementation. That's how you do it. And then the other thing you do is get educated. We touched on one little subject in a bigger subject of omega-3 status. And we are very honored here at the Gaeta Institute for offering a really important new course called Versatility of Omega-3 for Athletic Performance and Brain Health. And this is being taught by 2 dietitian nutritionist colleagues, Tavis Piatoli, who's a sports nutritionist, a sports dietitian, very advanced. And he's going to be talking about athletic performance and brain injury, concussion, brain injury, really, really important subject. He's like super duper expert on this. And Kelly Patterson is going to be talking about cognitive health, healthy aging, cognitive performance, memory, all this good stuff, like having a healthy brain and what to do about that. And going through a lot of science, evidence, research, clinical experience on this subject. So we're going to be covering athletic performance, brain injury, cognitive health, and healthy aging, all in one seminar. And if you're listening to this video before August 4th, 2023, come listen to it live, and then you get to ask questions. If you're listening to this video after August 4th, 2023, no problemo. Just register for the course at the Gaeta Institute. It's very inexpensive. And you can listen to the recording, get the slides, the notes, also some of my notes and slides and presentation materials on omega-3. It's really important. So register for that. And on this page, you'll see this page in the description of this video, you will see also on this page with the description, what you're going to learn, and all kinds of things. And it'll also tell you what to do if you're a health professional to set up your health professional account with this great lab. This is the one I use. And if you're a patient, it'll tell you where to click. It'll have the link right there, and also be in the description for how to order your testing. They offer a bunch of tests, but this is one of them, and the basic core. Everybody needs to do this test. Okay, and this is one of the dozens of courses we offer here at the Gaeta Institute on hormone health, autoimmune health, herbal medicine, business training, cancer support and prevention, all kinds of good stuff. We have dozens of courses here for health professionals and the public, health conscious public, in holistic health and natural functional medicine. We talk a lot about omega-3 in the cardiovascular program, and also in the cancer course and the autoimmune course. So in those courses, you'll learn more. And we have a functional medicine certification program. You'll see the details for that here. And for anything that we have, everything we have is at our homepage. You can access everything through our homepage, michaelgaeta.com. And you'll see here the clinic. If you have not yet had a consultation with me, or if it's been at least a year, it's really important to get an annual checkup, look at your labs, come up with a customized health protocol for yourself with diet and lifestyle and nutritional, herbal supplementation, customized for you and your concerns and health goals. And you'll also see here on our watch page, my weekly podcast on Mondays and a big video library, including me playing the piano for you. My blog is here. We have our practitioner intensive coming up. It happens every year, our 8th annual intensive coming up in September here in Colorado. So you can access our courses, our events page, patient consultations. I also consult for a lot of practitioners and all kinds of good stuff, all at michaelgaeta.com. And if you ever have any questions, just email us at support@michaelgaeta.com. And then if you're not in the US, we'll give you links if you're a US person and not working with a functional medicine health professional, natural health professional. We'll also give you this link, which is also for our Canadian friends. If you're in Canada, you can order these exact same products and other ones besides through this link, which you will also find in the description for this video. So again, michaelgaeta.com. Any questions, just email us at support@michaelgaeta.com. Thanks for listening. I'm Dr. Michael Gaeta. I've been practicing Chinese and functional medicine as an acupuncturist, dietitian, nutritionist, and herbalist for 33 years. As of this video, maybe you're listening to this in the future. Really happy to be with you today. But let's help these kids. Let's help the adults. Let's improve psychological, mental, emotional health and well-being. Why not get the most out of life in a very simple way? So thanks for listening, everybody. I hope to see you in a clinical visit, a consultation with me, or in a Gaeta Institute course, including this omega-3, this brand new omega-3 course that we're offering for you. So thanks again. Blessings to all, and take care.